Well, we've been talking so much about patients and healthcare workers fighting COVID-19, but others are suffering as well. Many children and adolescents are feeling the emotional effects. Joining us to talk more about this is Ari Steinberg, Ph.D., Clinical Supervisor of Ambulatory Services at Hartford Hospital's Institute of Living. Ari, thank you for joining us.
Thank you for having me.
So during non-COVID times, you see many children in the child and adolescent outpatient programs. What do you typically see?
Correct. So we run the outpatient services at the Institute of Living, and we offer services to children from ages ranging 5 to 18, and we service them and provide clinical support through group therapy, individual therapy, family therapy. We offer medication management as well as family support groups. A lot of the children and adolescents that we see really require that intensive clinical intervention. So we see kind of the higher risk population.
Mental health so important. So tell me what you've been seeing during this coronavirus outbreak.
So since the outbreak, what we have been seeing, and rightfully so, given the uncertain and stressful times, children are experiencing disruptions in their daily schedules. Social distancing is requiring that they isolate themselves from friends and sometimes even family. So most kids are struggling at some level. What we have been seeing is an increase in depressive symptoms. In the littler kids, it might exhibit itself more as irritability and frustration. In our older teens, it looks more similar to what you would see in adults: depressed mood, lack of motivation. We are seeing a lot more increased levels of anxiety, overwhelming worry, and then kind of new, and I think it is a result of the crisis. We're seeing a lot more conflict within the home, within the family. And obviously everybody is with the stay-at-home policy, everybody is staying at home together with not as many resources as maybe they would normally have. The other thing that we've seen in recent weeks in our older teen populations is an increase in substance use and potential abuse.
All right, so what do you recommend for parents to support their children during this pandemic?
I think, we at IOL are here to support, but I think there are things that parents can do at home that don't require intervention. I think it's key to help their children to feel safe and secure. So, and allowing them to do things in their control that helps to keep them safe, because everything feels so out of control right now for most of our children and adolescents. They don't have a lot of control. So the things that they can do: they can stay at home, they can wash their hands, they can talk about their feelings with their parents. So really giving them a sense of control. The other thing that kind of falls in line with that is maintaining their structure and routine. I think that's really key for our children. Having them follow the same routine that they would if they were getting up and going to school. So getting up at the same time every day, getting dressed, performing their daily hygiene, brushing their teeth, going to bed at a normal hour. We're seeing a lot of changes in sleep patterns, so trying to keep these kids on a consistent schedule as if they were attending school and other activities in life. The other thing is allowing them to find moments of normalcy during the day. Yeah. Times that they could share, things that they could do anytime, that it doesn't have to be specific to staying at home. Okay. So if it's family game night, if it's movie dinner night, things that they would be doing whether we were experiencing this COVID crisis or not.
All right, Ari Steinberg, thank you so much. We have to go. We're out of time. I apologize.
Okay.
We really appreciate your time today. Thank you very much. Keep up the good work.
Thank you for having me.
Thank you.